Guys, I want to talk to you guys about these superbugs. We're starting to get some crazy bugs in our world that can do some pretty crazy nefarious things. So understand this, 25% of cancers in general come from bugs, bacteria, viruses, fungus, etc. But now we're starting to see the aftermath of COVID. So yes, there are people that got the vaccines and so forth, but there are also people that did not and are having issues. And those issues can be cardiovascular issues, could be neurological issues, a lot of nervous system problems. Like you'll see young people have arrhythmias and it's like, why is that person having an arrhythmia? Or a person having their heart enlarged, going to congestive heart failure. And this is a well-documented phenomenon. Before COVID, many bugs, many viruses most namely, can cause this. Will cause your heart to enlarge, will cause issues at the heart level, but also at the nervous system level. So there is a phenomenon now that we're starting to see more and more from people that are not vaccinated, inclusively, we see it from both, but from people that are not vaccinated, called long COVID. So you have this acute phase of COVID, but then you have this long lingering phase of COVID where you get the cold and then you'll get something weird, like you'll lose sense of smell or balance, right? You get a little dizzy, etc., after catching this bug. And this is something that can stay with you for a little bit, but also can cause issues at the wall of your arteries, something we call glycocalyx, which is like this layer, this protective, like slimy layer, let's say, in front of the endothelium, which is the wall of your arteries, and just silently eating away at your arteries. And what's happening is young people developing more plaque earlier in their heart, predisposing them for a myocardial infarction, which just means heart attack. So guys, one thing I would suggest for you guys is to do deeper blood work and check, for example, if you do have the spike protein. Spike protein is something that will stay inside of you for quite some time. It could be cleaned out, albeit a little hard. It'll stay inside of you after getting this infection. And then there's other markers that you'll check alongside to make sure that your body's immune system is being able to fight. And these are not traditional markers like TGF-beta that your doctor would check. Not all doctors will know how to work with this, but this is a thing and it is something here to stay. And the solution is to boost your immune system. Boost your immune system, get inventory on your health, do in-depth blood work, not the regular blood work your doctor does that's covered by insurance. So that's a false sense of assurance. Do in-depth blood work. And if you guys want, come to Biohacks. We're 50 state licensed. We can help you understand better the ramifications of the infections you caught during your lifetime and what they're doing to you.